I hope these remarks won't be as incendiary as my previous ones, and I'll be very brief. It seems to me that there's not just a balance of factors, of the solidarity and welfare, general welfare factors, and autonomy and liberty factors in the Constitution, but rather it seems to me that for those of us who actually think more weight should be put on welfare and solidarity considerations, we find ourselves having to wage war against those who want to emphasize the Constitution, and they have a sort of leg up in this kind of debate. And I'm just wondering what you think about that.
Well, it's interesting. I mentioned Joe Ellis's book, and that deals, as the phrase founding brothers suggests, with the pre-constitutional phase of the United States. So it's basically sort of the hashing out of the principles in the Declaration of Independence and that whole period that led up to up to and including the writing of the Constitution. But those of you who read the book know that he contrasts, say, the Jeffersonian perspective, which was heavily, individual rights focused, around some of the other undercurrents that were expressed in some of the writings of others at the time, as we were sort of debating this notion of creating a new nation and what form that should take, whether it was the pre-constitutional phase versus the constitutional phase. It is very clear, as you say, when we got to the constitutional phase, boy, that's when we started hammering home the notion of individual rights, and the Bill of Rights being the case in point. So so when you get to I don't think it's any mystery then that when you get to an argument over the Affordable Care Act, in a context in which you have some very strict constructionist originalists like Scalia, this notion of individual rights is going to be foremost in their minds. And of course, as it is for Justice Kennedy, this notion that the most important thing in the Constitution is this protection of individual rights and liberties. And right. Pulling out even those phrases of the Declaration of Independence that speak right. to that as well. So, where does one go from here?
So we're not disagreeing.
We're not disagreeing at all. We're not disagreeing at all. That is, and that is, as I say, I think why you see this tug constantly back to the individual framework for us to do anything, even something of a public health nature. Or I'll give you another example. Look at what the administration is now calling out about the Affordable Care Act as a way of reminding people that there a few good things have already come into play. The number one thing that is singled out now is and part of this is just, it's the only argument they have because not that much has gone into effect. But for example, one of the changes in the insurance provisions is that adult children now can stay on their parents' policy up to the age of 26. That's sort of the special relationship piece that Dan Brock was talking about, but it's still very much, so here's a benefit for a person, for lots of individual families. Your special relationship, your adult children can stay on your policy. So we have to tug it to that level to justify this law that is going to have much more effect on many, many more people, 30 million, many of whom low income, et cetera, all those arguments that, and then tying to the argument that a Solicitor General really was making, unless we can see these people as individuals, we can't care about them. We can't think about them as a mass that we need to benefit in some social context, or we can't even argue really that the insurance market is going to work better for all of us if there's an individual mandate. We really can't make that argument. We have to talk about the freedoms and individuals, freedom from disease, before this argument really resonates for Americans.
Great. So I've got one brief question for Professor Cutler and then two for Professor Brock, but I welcome anybody jumping in on any of these. Dan, you don't have to be on the hot seat. Professor Cutler, just a clarification question. When you're talking about why economists prefer statistical lives, you talked about sort of bias and accuracy. I just want to understand a little bit more what the baseline is. Is it as against revealed preferences? Would people actually choose that statistical lives more accurately capture that? So to understand bias, I just need to understand a little bit more what you meant by that. Professor Brock, so I'm largely sympathetic, but let me be a little bit ornery and suggest here's a possible defense that intersex multiple of those categories or a couple of them, or just to suggest one thing that I like about the way you frame this is this approach to the problem that you gave is kind of independent about what one's moral theory is, right? It's a general refutation for everybody. But imagine, for example, one was a prioritarian or a sufficientarian, that is your moral theory, and you have uncertainty about who is going to be in the population, right? So given that you know the person who comes to you first, who's identified, is below the threshold or is low on the priority, you don't know what the rest of the future population is going to be or what they're going to be made of, whether that might, in that circumstance, be an argument for someone who subscribes to one of those moral theories for preferring the identified lives. And then a related just sort of idea has to do with sort of preference satisfaction in one's theory of welfare. So something that Professor Daniels has said in his writing on the subject, and again, I'm skeptical, is that the warm glow or the feeling of rescue, all these good things, might actually count as a reason to favor identified lives. So my question for you is whether you need to take a position on whether to count irrational preferences. So if it turns out that the preference for identified lives, the warm glow, turns out to be irrational for the reasons you gave, could one still argue that the benefit from that irrational preference still counts for something?
Sure, I'm pretty sure I have the easier one in this. Think about.
I'll answer yours, you answer mine.
I was going to make that offer beforehand, but I'm definitely not doing it afterwards. Think about two scenarios. One which is there are 250 people trapped in a mine in Chile. How much would you pay to save those people, you know, to dig a whatever replacement? Well, I can't remember what the heck they had to do. And then the second is how much would you be willing to pay for a detector in your house that's going to detect minute levels of gases such that if everyone across the country bought it, 250 lives would be saved? So those are the same number of lives. The economist view would be that the second is much more reliable than the first, because for all sorts of reasons that we were talking about, but that if they had to use a number, they'd use the number from the second one.
I would agree with that, so now you can answer my questions. To the first question, suppose you're a prioritarian and you have uncertainty about the others, then you could have, if you have complete uncertainty about who's in the statistical group, then you could have a reason for preferring that identifiable life. But that's just an example where certain empirical information can give you a reason for favoring the identified life. But of course, the reason then for doing so is that that empirical information is true. And there would be other cases in which it wouldn't be true. And in those cases, of course, then one has no reason for favoring the identified life. So what that means is that's an example of what I, at the end, called, here's a different kind of argument that would show that in practice, it can be justified to save, to give more weight to the identified life. For the warm glow example, basically it's the same thing. Namely, that's an additional, an economist or a utilitarian each might say, that's an additional utility we get from saving an identified life, which we don't get from saving an statistical life. And in practice, when we get that warm glow, if it's at least reasonably warm, then we get an additional benefit from saving the identifiable life. And so that gives us a reason for preferring the identified life. Now, there may be circumstances, however, when we don't get that warm glow. The identifiable life may be an example, may be an instance of a group that is strongly disliked in the society, and there wouldn't be a special warm glow from saving that person. So again, it depends on the truth of the empirical claim, and the empirical claim wouldn't always be true. There'd also be some people that, you know, it doesn't matter to me, I don't get any warm glow from saving somebody. So that's not a personal response. That's
Okay, thank you. So this is a comment, and it may be a question, I'm not sure, but or a combination of comments for Dan and possibly for David. So one of the things we're doing in this session is framing the issue. We've been operating with a distinction between identified and statistical lives. But in the literature, there's also something in the middle of that, which is an anonymous life. So if you talk about a group of 1,000 people and you know one of them is going to die, but you don't know which one, that's an anonymous life. A statistical life is where we each have a 1 in 1,000 chance of dying, and it may turn out that no one dies, one person dies, 1,000 people die. Now, Dan, your arguments number 3 and 4, I think, well, they all went very fast. 3 and 4 went particularly fast, I think. And I did have about aggregation. And I did wonder, and maybe we can't settle that here now, whether you were really using the notion of an anonymous life rather than a statistical life in your calculations there, because you were assuming that a person would die. Yet if we're in the realm of the statistical, that can't be assumed. It could be none, it could be 1,000, most likely one. But I really want to make a different point. So in the UK, we have a document called Reducing Risk, Protecting People, which is about using really cost-benefit analysis in health and safety and in transport. And there's a point in it where a price is put on saving a life, and that is £1.3 million, so we're worth much less than you over here. And if you go to the Czech Republic, they're worth even less, I think, over there. So I mean, it's quite interesting that these figures do seem to vary with GDP, but not directly. Actually, the higher the GDP goes up, it seems to be an exponential effect. Mm-hmm. But there is a notorious footnote in this document, and I think it's derived from Thomas Schelling's work, because what it says is that people may think we're being callous in putting a price on life by valuing a life at £1.3 million. But we're not putting a price on life. What we're doing is putting a price on very small risk reduction for very large numbers of people. And for a type of shorthand, we aggregate that to a larger number. Now, what's interesting is they don't say they're giving priority to identified lives. They don't say they're doing the reverse. They just say they're not talking about them, right? So my question, sorry, long-winded question, but the reason for the preamble is to say, actually, I think there are two different questions. One is whether identified and statistical lives are the same subject, and on consequentialism they would be. You would only talk about expected lives. There's another question, if they're different subjects, do you give priority to one over the other? And I think what was interesting in one of your remarks, you pointed out there's an argument that said you would actually give priority to statistical lives, which is an indication actually that you're accepting they could be different subjects, right? So I think we do have to separate those two questions out. Is it the same domain of discussion? If it is, then there's no priority. But if it's a different domain of discussion, then we don't yet now know how it's going to turn out in terms of the comparison.
Well, on the first question of anonymous versus statistical, I think my argument goes through with either of those, because one aspect of what I cited in I don't know which it was, yeah, the fourth argument, one aspect of that argument wouldn't go through with statistical if, in fact, no one was saved, because you couldn't say, well, there's actually more benefit from the prevention because you reduce the risk for everybody and you save somebody. Whereas in the anonymous, where you do save somebody, then that suggestion, which I find weird in any event, but nevertheless, that suggestion would go through. So I think the argument I made there goes through with either of those. Now, your second point was, I guess I don't think I understood your question well enough to say anything very intelligible about it. The idea that there are different domains. Well, I think I should just say I don't think I understood it well enough to say anything intelligible about it. If you want to say it.
Well, I thought it was a simple question, so I missed it. Got it wrong. And the point was just that it's one.
Could you speak to the mic?
So it's one thing to say that we should reason about these cases in different ways. And it's another thing to say our reasoning ought to lead to different conclusions. That is, so the Health and Safety Executive gives us a way of reasoning about statistical lives and says they're agnostic about whether that reasoning applies to identified lives. In fact, they imply it doesn't. So you could say that statistical lives we calculate one way, and the reason for that is because if you take their suggestion, then small risk reduction turns out to be a normal consumer good. Because we're all buying smoke alarms, we're all buying things for our cars and so on. So it just becomes a normal economic good. And so a lot of the argument about statistical lives is that we make this big fuss about putting a price on life. In fact, all we're doing is what we do all the time, which is trading off safety, changes in safety against other things. I mean, and I think this was the message of the original paper.
I would certainly accept that argument that it's the same kind of decision that one makes all the time, whether to put smoke detectors in, so forth and so on. What I guess I would want to hear him say, and I happen to know that you work with the transportation folks in Britain, what's the reason that we should think about identifiable lives and the resources to be used for saving them in a different way? Now, I'm perfectly happy to think that he may be able to give us a plausible answer, but I think he needs to be able to give us an answer to justify his claim that the reasoning he uses just doesn't apply in this other area.
Just one fact about the British numbers, which is they're about 3 to 6 times lower than what people in the States tend to use. And I've never quite understood why people in the UK use such lower numbers. And on the income relationship, there aren't very good estimates, but there's sort of one study that suggests that the value of a statistical life goes up more than proportionately with income, about 70% more than proportionately with income. So that as countries get richer, the value should be going up even higher.
Yeah, we use 6 to 7 million most commonly, I think, here.
Yeah, the folklore about NICE is that they use about $30,000 per QALY. Pounds. But no, when you translate it into dollars, it turns out to be about 30,000. And that in the U.S., the estimates you see are anywhere from 100,000 to 200,000.
We're just worth more.
Thanks. Just thinking about huge exchange rate fluctuations of the past few years when you were mentioning that. First question is to David. Your 2 examples to show that economists have a preference for statistical over identified lives also involved cases where that for which the economists had a preference was a choice situation. Someone is exercising a sort of self-interested preference, right, versus asking someone, well, how much would you be willing to save to spend to save this identified third party? And I wonder whether that's really at the source of what the economists prefer. And the thought is that economists think that people have a much better idea of how much they value different things in their own life than they do about how much they value some other person's life, whether or not that life is identified. So it reminds me of, so Rawls proposed that we try to reduce in earlier work the theory of justice to a theory of rational choice, right? And one thing he said was, well, we don't have a very good idea how much weight we should give to our altruism, right? When we're thinking about how much money we should spend on a third party, that's one question that we have to address. Although I suppose if we're just making trade-offs between people, it's not clear whether we need to address that question. But does it really all come down to economists thinking, perhaps rightly so, that when we're thinking about our own lives, we have a better sense of what we value than when we're thinking about the lives of strangers. Question to Dan. I think it was the slide involving aggregation. One thing I wasn't so clear about was you talk about a case in which 1,000 people have a 1 in 1,000 risk of death. And this is a case with an identified person, so presumably we know which person is going to die. Okay. Now, obviously, if it's merely epistemic risks, then that's not coherent, because then you know that person's got a certainty of dying and everyone else has a 0% chance of dying. I suppose that what you're assuming is that, okay, well, each of them had an objective 1 in 1,000 chance of dying. And I suppose that maybe what's going on in that case is, well, when you know who's going to die, it seems that that sort of swamps the fact that each had a 1 in 1,000 chance of dying. Okay, well, you know, now we know actually who's going to die, and then we'll just focus on that rather than the chances. I'm not sure this is a challenge to anything you've said, but I was just wondering about I was just puzzling over that particular example.
Let me just start off, although Tom should really answer the question as much as I should, but I think it stems from the idea that people are probably better at making a determination about their own budget and themselves than they are about a sort of generic set of others. I mean, in the back of my mind is the sort of issue that if you ask people, you know, how much are you willing to pay to save, you know, 10 baby seals, you'll get some number X. And if you say, hey, how much are you willing to pay to save 1,000 baby seals, you'll get, you know, X plus 2 cents. Right. And so people just don't have a conception about, you know, about some mass and big numbers, whereas what they do tend to have more regular feedback with is their own budget about themselves or their family. And so you're at least giving the individual a fighting chance of doing that. But that said, you know, so many people make so many mistakes that with these things that it's hard to argue that that's going to be ideal also.
Tom, did you want to add to that or not? I'd just like to mention two things that may not have been considered. One is the fear of death. Suppose we knew that one identified person would die in 5 years, and 1 out of 1,000, a well-known 1,000, would die in 5 years. Or 1 out of a well-known 100 or 10 would die in 5 years. I think probably there's a difference in the agony of fear. Fear for oneself, fear for one's spouse, fear for one's children, fear for one's parents. And if it's 1 in a million, my guess is nobody in the million cares. If it's 1 in 10, every one of the 10 is almost as fearful as the one identified might have been. And therefore, I think that there's a difference between the fear of anticipation. And I don't think we really know how people respond, but my guess is that 1 in a million, nobody's worried. 1 in 100, they're worried. And this probably shows up when people talk about how worried should a spouse be of somebody who goes off to Afghanistan to risk his or her life. The other thing I would mention is that Dan referred to the Chilean miners. I think an interesting way to think about the warm glow is this. Suppose the Chilean government had decided that it wanted to suppress any broadcasting of the fact that all of those miners might not live. And they had mobilized, as they did, a rescue. And the rescue succeeded. And gradually the word will leak out that the Chilean government managed to organize a rescue of so and so many miners who were truly not really expected to survive, but wonderfully they did. Now my question is, how much world welfare was lost for lack of broadcasting what was going on? It must be that people get enough joy out of a scary movie that ends well, and people get a lot of joy out of which soccer team won. And it seems to me that maybe there's even a sense of solidarity among the public, all feeling that we have been trembling, waiting to see what will happen with these miners, and the joy when they're finally successfully rescued must go into what I think in the country of Bhutan would be called the index of happiness.
I just want to add one thing, which really speaks, Tom, to the point you were just making about fear of death. We just published in our April issue a series of articles around how people value high-cost cancer therapies. And part of this really goes back to the notion of cancer and the exceptionalism of cancer and the fact that cancer has a grip on us like no other disease. But this cluster of articles looks at, for example, how much would people, and some of this varies as to whether people have cancer or not. But for example, metastatic cancer patients, according to one of the studies, if you ask them, which drug would you prefer? One of two drugs. One has a low probability of longer survival, say 9 months, 10 months. The other has a high probability of lower survival. Which one would you rather have? Metastatic patients always vote for the first drug. They would rather take the risk for longer survival than the higher probability of shorter survival. And so you say, okay, well, that's how you feel if you have metastatic cancer. We had another article that then asked people, how much would you be willing to pay for an insurance policy that guaranteed coverage of very high cost cancer and other therapies? People are willing to pay about 2.5 times the actual cost of insuring those drugs because of this fear of death. So, and of course, the argument here that many people were making is the nice approach of 30,000 pounds doesn't fly when you're talking about cancer, and it doesn't fly when you're talking about metastatic cancer in particular, because who knows what the increase is but what cancer patients would be willing to pay for extra months is probably multiples of the $7 million valuation a year. And it's just another interesting sort of layer, I think, to put on top of these discussions that we've just had.
Susan, let me just interrupt in response. I know you have to go, but I just wanted to follow up on your remark. What about other people who also dread cancer? Do they inflate in this way the value of cancer drugs that extend lives?
Yeah, that second example I mentioned was asked of healthy patients. Yeah, so, and again, you can ask how much of this is the special grip of cancer. That particular study looked at all specialty drugs, so it would also include, say, high-cost drugs for multiple sclerosis or whatever else. But you can sort of tell that what people mainly have in mind is cancer. But healthy people are willing to pay more for that protection as well.
Thank you very much. I just wanted to thank Susan for joining us and for adding her wisdom to this panel. And we will carry on with the other questions we have after you leave.
Thank you so much again, Nora. It was a pleasure to be here. I wish I could stay the whole 2 days. Thanks.
I'm not sure I understood your question, Mike. So you suggested that the identified life would swamp preventing the risk of 1 in 1,000 for the 1,000. And I think as an empirical fact about us, I agree. But the question is, should we give weight, for example, in policy to that swamping, given that we can expect one life on either side? Now, once we bring in the warm glow that we get with the identified life, then we've got a different question. But I guess I don't see, and I'm perfectly happy to admit that often there is that kind of empirical consideration. And then I agree that there's a swamping. But that swamping doesn't give us any reason, in my view, to say that the identified life in itself should get more weight than the statistical life.
Right. So when everyone knows who's the one person who's going to die, then the other 999 aren't bothered by the fact that they had a 1 in 1,000 risk.
Well, I don't know. I was imagining that we don't know who the one person is in the group of 1,000.
Oh, this is a case of maybe Joe's anonymous life. Is that right then? So,
Yeah,
sorry,
right.
This is a huge line in back. I better stop.
Yes, it is.
Okay, Nir?
I wanted first to say something about the fear of death. My sense is that this issue is ultimately contingent with respect to the basic dilemma we're talking about, because by the worry about spreading fear of death, somebody may be thinking about the fear of death in the population at large from dying, but that's, of course, to diminish that fear, we just need to save as many statistical lives as possible so as to give the most people a greater chance at not incurring early death. We have in mind the fear of death that is in place after an allocator has made some decision to keep somebody at grave risk or to spread the risk more evenly among the population. But and there, in that situation, somebody is facing very severe fear of death. But about that situation, it doesn't have to last long. They don't need to know about what the allocator has done. So in many of the actual dilemmas that we're talking about, the allocator will continue to have a dilemma even when the fear of death issue is irrelevant in that context. So I think that the dilemma itself is still something that we need to resolve independently. I had a question for Dan, which actually relates to this. It's basically about how much we should take into account these contingent factors in thinking about this dilemma. So your conclusion was something like, I can see the consequentialist case. In some contexts, there will be this dehumanizing effect if we don't do that. But you said that's a merely empirical issue that arises only in some context, that bias itself is not justified. However, we came to this discussion today thinking about actual policies in the world. It might just turn out to be the case that with respect to most of these policies, maybe I'll talk about AIDS prevention and treatment, maybe with respect to many of these dilemmas, when the government, which is an agent that has a lot of impact on how dehumanizing our culture will be, maybe with respect to many of them, majority of them, the empirical facts that you alluded to do apply. And so I think you're right, but we shouldn't jump from that to any kind of anything remotely like kind of policy decisions about the bias. Bias may be justified.
I didn't mean to jump to that. It seemed to me what I was trying to do is to sort out for myself anyway. Well, why is it that we find this fact that we tend to give more weight to identifiable lives in a wide variety of circumstances? Is there a good moral reason for doing so? Well, one good moral reason for doing so, if one of those 6 or 7 arguments that I showed mapped onto the distinction and picked out something morally important. I'm skeptical about that. A different reason for giving weight to the distinction, what I called in practice or in policy, would be if the empirical facts of the sort I gave a couple examples of were in fact true. I think there's no doubt, for example, that in the HIV example, more money can be raised from donors for treatment than for prevention. And that allows you to save more lives. And one doesn't have to say that the identified lives are more valuable. One just has to say one can save more lives if we support a program that focuses on identified lives. So I think, in fact, many, or perhaps most, of the actual policy issues do have empirical components that give us justification for some bias in favor of identified lives. But I think what I would conclude out of analysis I gave is that we ought to figure out in those policy contexts what those empirical facts are and whether they're true, because there's no reason to think they'll be true in all circumstances. And we would have good reason for giving weight to them just in case they're true.
Thank you. Next question.
Yeah, I wanted to go back for a minute to the discussion about how we value statistical lives in the U.S. and Europe, because the reason for the differences between the U.S. and Europe are actually not because different cultures value statistical lives differently. It's clear that they do. I think that's, there's a lot of cultural factors and other factors that drive differences in our willingness to trade off income for small changes in mortality risk. But the big difference is that in the US, we tend to use values of around 9 million based on revealed preference studies that show that that's how people trade off wages for job-related risks. Whereas in the UK and in Europe, they rely much more on stated preference literature that uses surveys to ask people how much they'd be willing to pay for different types of risk. And I don't think anybody working in this area understands why those surveys lead to substantially lower values in the 3 to 5 million range. So this has to do with, I think, cultural preferences for what types of data they're willing to accept more than some of the cultural reasons. I think if you did the identical study in the different countries, you do find different values, but that doesn't drive the difference between the 9 million and the 3. There's also something that was implicit in that conversation and some of the other things that I wanted to ask about. I'm more of an economist than an ethicist, so maybe I'm missing something here. But it seems to me that one distinction between identifiable and statistical lives is that if we're always reacting to the minors, and that's where we're spending our money, we're going to run out of money and not going to have resources to do things that benefit a much larger number of people. And why is that not a moral argument?
Against?
No, against favoring identified lives over
Against giving
statistical.
lives.
Yeah.
It is.
Okay. Okay.
Thank you.
You rarely get that simple
want to
answer
comment
from a
on-
philosopher.
Did anyone else want to comment on this question? Okay. Thank you. Peter.
Yeah, thanks. This has been very helpful. I think one point that was raised by various speakers, and almost always tends to slip out of consciousness, is that we're actually talking about the difference between statistical rescues and statistical preventions. That is, any actual rescue is a chancy operation. It can have downside risk as well as upside. And saying an actual victim or an actual life saved misstates the actual situation that we face in such cases, which is, should we prefer a statistical rescue versus a statistical prevention? And one reason for, as Dan Brock and Thomas Schelling brought out, one reason for favoring prevention in many cases is that you're benefiting a very wide population in terms of, let's say, reducing their risk, their fear of death, helping them plan in various ways. And so if you compare statistical rescues and statistical preventions, then I think you can structure the argument in a way that you would find congenial. The second question, this is specifically for David Cutler. When we look at these willingness to pay measures, it seems reasonable that that's a very good place to get such information. And I guess the previous question brought to the fore the idea that there is still a substantial amount of choice one has to exercise as to which kinds of measures one takes and which markets would be good markets for this kind of information. And one problem, I think, especially in the health case, is that people don't get very good feedback from their decisions about health choices or even safety choices. It's not like choosing a breakfast cereal or finding which coffee you prefer. And so you might think that, well, there are a couple issues there. One's an information issue. There's an issue about resources. Do the people who are making these decisions have the resources to make alternative decisions? And if you want good feedback, good information from these willingness to pay measures, do economists have a view about which markets to look at and what kinds of measures to use?
Well, I can answer the first question, which I agree with you. I meant to get at your point as I raced through those arguments when I took up the issue of uncertainty and arguing that, in fact, the saving of an identified life is only an attempt, and it may be more, our success may be more uncertain than in the case of prevention. So I fully agree with you.
I think the literature on this is not particularly great, and there are all those problems. That is, these are not frequent decisions and so on. There are even conceptual issues, like, if you think about the airbag example, what you're learning about is the willingness of people who are at the margin between those. Some people value it a whole lot, and you're not capturing their higher valuation, and other people don't value it at all, and you're not capturing that. So it's they're quite problematic, and there's not a sort of preventive services task force equivalent to say, like, here's the accepted way to do this study and here's not, other than that ideally you try and make sure people are as informed as they can, but no, it's not, the scientific basis is not as great as one would like.
Tom, did you want to say? Yeah, two more comments. One is this interesting thing about prevention versus treatment. One of the rather newly discovered phenomena is that antiretroviral treatment for HIV-positive people significantly reduces contagion, especially from mother to unborn child, but even from a positive spouse to a negative spouse. And that complicates that particular thing. The other is that Dan Brock insisted all other things equal. I've spent a lot of time on something you may have heard of it called the Copenhagen Consensus, in which we spend a lot of time trying to decide what's it worth to save poor people in developing countries that are subject to malaria death and death due to intestinal worms, death due to lack of micronutrients like vitamin A and iodine and iron. And the question always arises, do we deal with quality-adjusted life years saved, which usually suggests if you've got a family of 3 children and no father, and you have a choice between saving the mother and saving a child, saving the child saves a much greater life expectancy than saving the mother. On the other hand, saving the mother may mean that 3 children won't become orphans with nobody to take care of them. And I think this might even suggest that in terms of something like war deaths, that there may be, when death of somebody is imminent, there may be people who sacrifice themselves in the belief that they don't have any family to worry about, or they don't have any prospects to worry about, and there are other people whose lives are worth more, and therefore a person may elect himself, which I say reminds us that not all else is equal. And I think that probably these, I forget what they're called, ethical committees that try to allocate among people who need dialysis or something of the sort, I wouldn't want them to ignore differences in the people they're choosing among. And my guess is that most of the public would agree that some people are worth more saving than others. I have to admit that at my age, if somebody could save one of you or one of me, it would be a silly mistake to save me when they could save you.
Could I just make one quick comment and follow up to Tom's point, which is to underline one issue that we haven't taken up at all, which many would say a difference between people which is morally relevant in saving is how many quality adjusted life years you get from one person as opposed to another. And I think that's a question that ought to be on the table, if not today and tomorrow, sometime.
Steve?
So this is mostly for Dan. Dan, maybe one distinction we might make is between the relevance of these kinds of questions to issues of public policy and how governments ought to act and how we all ought to act as an organized body on the one hand, and on the other hand, how individuals may or act or how they must act. So you were noting, I think quite rightly, that many of us feel that there are special obligations that we have to certain individuals, special relationships and so on, and maybe that could be given some consequentialist basis, but you might think it doesn't have to be. I'm wondering if one of the ways of thinking about what happens in these cases where, from a certain policy point of view, we might think of it as a kind of bias or a certain kind of prejudice, is something that's sort of incipiently in the direction of a personal relationship. That is, so take the Chilean miners, for example. I mean, Tom Schelling was saying he wouldn't want individuals to be bereft of these human emotions that respond to others. I think part of what goes on, as Tom was pointing out, we start cheering for these people. We develop a kind of relationship with them. Now, if we're permitted to, by the way, we should just all accept, I think everybody to the dispute could just accept the equal value of all lives. That needn't be in dispute. The question is whether what governments on the one hand and what individuals may or must do given the equal value of all lives, and whether they can give some preference. And now, again, I want to return to the individual case or the groups of just voluntarily organized individuals, a society that focuses on this disease or a society that focuses on these people. Well, it seems to me part of what goes on there is something like a personal relationship that develops. And yeah, it seems to me we are permitted to give some special concern. We don't have to have a justification of the kind that, say, the government might require or that we all together might require if we're acting on everyone's behalf. I'm just wondering whether making that distinction between individuals and organized groups on the one hand, or voluntarily organized groups on the one hand, and on the other, something that by its very nature has to speak for all, whether that doesn't.
The individual case reminds me of William's one thought too many.
Yeah, exactly, right. That's right. Yeah.
So it certainly is. We don't, interesting, whether we think that a government can have special relations. We usually do think it has special relations to its citizens, right?
Yeah, right.
And so the Chilean government had a reason for trying to save those miners that we didn't have, our government didn't have. Yeah. So, but I think the most natural and the most common examples, you're quite right, arise of the special relationships in the individual case where we think, exactly as you put it, we don't have to give a justification for saving my spouse as opposed to the two strangers. Most of us believe that that's a permission that we have. I can exercise it as I wish. So it's now. So it certainly is. That much is, I think, right. The question of how much the special relationship sort of seeps into the government example, certainly in some cases it does. I think it probably is not going to get as much weight in most policy questions as it does in most individual questions. But I think you're quite right. Special relationships aren't either all or none, right? They come in different degrees, and so they're going to get different weight in different contexts. I guess that's all I can think of to say in response to you right now.
Thank you. Grace?
My question or point of view might be very naive, but in my opinion, we're all statistical individuals until we become identified. So once we're identified, wouldn't we want for another identified person what I would want as an identified person? Now that might increase healthcare costs so that anybody could get anything they wanted, but we all have the potential to be an identified person. We're talking now as though I'm not the identified person. I have to decide for this identified person, but that could be me. And thinking as an individual, I would worry about what would happen. I am statistical now. This next second, I could be identified. So how do you handle that?
Well, you don't want to spend all the resources that everyone would want for themselves when they become identified, because that simply ignores the opportunity cost. I sound like an economist, but that ignores the opportunity cost to me, right? Because you said you could become an identified person. Well, you are, of course, at the moment, but you could become. But and that's of course right. But most of the time, you won't be an identifiable person at risk of death. You'll want to be doing other things. And if everything that anyone would want should be given to them when they're in identified circumstances, there would simply be too much spent on those kinds of rescues.
But the point is, I might not be, or you might not be. But shouldn't somebody who is, if I were that person, I'd want it. My probability might be low or high, but for somebody who does get identified, shouldn't they have what I would have wanted?
No,
To me,
not
that's
always.
a moral question.
No, not always, it seems to me.
Well, because people think totally in terms of the economy of it.
No,
But that's why people jumped into the well to save that Jessica, because that could have been their child. They identified with the person, with the identified person.
So you have to beware of philosophers who spent their early years in finance, but like Dan. Thank you, Grace. Joe, you have...
Sorry, I can't resist going back to the question about the reason for the difference in the value of life in the UK and in the US. So it is true, as a previous speaker, commentator said, that in the UK we use express preference studies, and in the US you use revealed preference studies. And insofar as we justify it, you can see these economists making, broadly speaking, Davidsonian arguments about the holism of the mental, and you can't go from anyone's action to anything about their preferences. So we have to ask people about their preferences rather than impute them. But the interesting thing is that the first study that was done using the express preference methodology came up with a much higher figure than one we actually use. And this was then given to the civil servants to try to work out what we should do. And we were using a much lower figure before based on social capital. And in this document, the civil servant says, well, we can't really have a much bigger figure than we've got at the moment, because we couldn't have too big a gap between existing policy and real policy. So we don't like this figure. So they manipulated it. They used the median rather than the mean, which brought it down, because the median is always lower than the mean in these things. And then the minister said, the civil servant said, and the minister is very concerned about keeping the traffic moving. And the assumption was that safety measures would slow everything down. So he put a completely arbitrary and unjustified figure of a few £100,000 for the value of keeping traffic moving. And we ended up with a figure of about £800,000 at that time. And every study that's been, and that was not justified by any methodology, that was just pulled out of a hat, really. And every study that's been done since has come up with a range value, not a point value. And the range value is always consistent with the existing figure plus inflation. And that's what we've got. So despite all these claims of scientific use of economics, it's simply used as a way of rationalizing something that was a political decision in the first place.
I was going to, I say this only because you're a friend of mine, Joe, and so you'll know it's intended to be a joke, but I thought you were going to offer yourself as an example of why British lives are worth less than American lives.
Bad result. Okay.
I was just, in response to the earlier comment, what I'd been thinking was the range of studies is not all over the map, but it's a fairly wide variation, and one could choose a number on the low end and justify it, one could choose a number on the high end and justify it, and so on. And what's interesting to me is how the political process then settles upon a particular number, whereas, as we were saying in the United States, not only are you not allowed to use a particular number, but you're not even allowed to, in government, use something that might then be an input into using a particular number. And so it's kind of wholesale avoidance of the issue on one side versus sort of choosing a number that seemed to make sense on the other.
Tom, did you want to add something?
Yeah, on this question of how people, when asked, tend to value their own lives, there have been some experiments in what difference it makes whether you simply ask individuals and give them maybe half an hour to think it over, or get a dozen individuals to spend the day talking about it together. Because there are a lot of arguments that won't occur to an individual in a half-hour conversation, but is likely to occur to at least one among a dozen people if they have a whole day to be responding. And there was one study, it's now about 20 years ago, done at Brookings Institution, of looking at the question, what was the difference between values of one's own life in Russia, Ukraine, and the United States? And essentially, they went around knocking on doors in Ukraine and Russia and asking whoever answered the door how they would value their own life. And they had about 5 minutes to answer. And it turned out in the United States, nobody would answer the question in 5 minutes. And in fact, most people would say, well, wait a minute, I have to call my wife, and would consult. So that it makes a hell of a lot of difference whether people are induced to reflect on this and talk about it and think about it over and over.
I've been thinking about Thomas Schelling's use of discussion of empathy and Dan Brock's warm afterglow. And I guess one of the questions I'm wondering is, are those the same thing? Or is there are there some distinctions, perhaps, between the two? And that led me, and I guess this is a question for Dan, is when you were talking about the warm afterglow, you're thinking about it, it sounds like, certainly as an empirical question, but thinking about it as in a particular moment, do we get warm afterglow, will the warm afterglow raise more funds for X, Y, or Z? But is there any value or insight into thinking about this not in that utilitarian sense, but as empathy, or call it warm afterglow, that is in a sense a byproduct or an inescapable component of other things, other moral principles we value. So that if we want to be a society that, for example, considers that has altruism, that has empathy, that values even special relationships, we're kind of stuck, perhaps, with the byproduct of the fact that sometimes we will overvalue identified lives.
Let me give a analogous, or struck me as analogous, you may show me it isn't, but in debates about mandatory helmet laws for people who ride motorcycles, some people claimed that, well, if I don't wear a helmet, I want to be free not to wear a helmet. If I have an accident and bleeding on the street, just leave me there because I could have prevented it. And many of us say, well, we don't want to be the kind of society that leaves you bleeding in the street. You're creating an externality for us, if you like, that we want to avoid. So that shows that the analogy is that the effect on us and on our motivations, on our psychology, on our moral motivations, may be something that we want to avoid, and it's a warm afterglow makes it sound, it sort of trivializes it. Whereas in fact, we can be talking about, other people make this point in terms of dehumanizing us, and then it sounds like a more serious effect. And that's, dehumanizing us is a more serious effect if one cashes it out, I think. And it's more than just, oh gee, I wish I didn't have to see that happening. And then I forget about it shortly thereafter. So that's amusing in response to your question.
Just a quick follow-up on this issue. So one of the reasons we might have for paying attention to what you referred to as an afterglow is the suggestion that there are these externalities that we ought to take into account in the total calculation. But I took the thrust of the question that was being asked to be focused more on, in a certain sense, what should our concerns about other people be? And should we have these kinds of externalities, or things you're referring to as externalities, when in fact they really are the emotional concomitants of, say, concern for others in a setting. So suppose we were in a society in which these externalities were rather minor. We might think of that as a pretty callous society that we wouldn't want to live in, perhaps. Should one ask a kind of critical question about what sort of attitudes we ought to be expressing to other people, and not simply what ones do we happen to have? Yeah, that was to you, Dan.
Well, I think I'll quote Tom here, that the life you save may be your own. And so when we point out to people that in fact we're saving fewer lives, when it's pointed out that in fact we're saving fewer lives, then is that a way to express the value that we give to life? Well, it sounds a little funny, as Charles Fried pointed out 30 years ago, to say we express the high value we give to human life by saving fewer lives than we could otherwise. So I think you're right that it is what attitude should we express, and that I take it as supposed to be a moral question. And on the one hand, you have the life you save may be your own, or alternatively, it seems a funny way to express the value, the high value we give to human life, to save it less than we could. And then what one needs to say is, well, what are the alternative moral considerations which justify which justify saving fewer lives than we otherwise could? If we wanted to turn this conference into a session in moral philosophy for the next day and a half, which I doubt, I mean, it'd be okay with me, but I doubt for the rest of people, then we could try to explore what those moral considerations are. But we would have to find what they are and say what they are.
Thank you. Regarding the safety and externality, there was something hilarious in Italy some years ago when the safety belts were mandatory. So the Italians started wearing a shirt that have a black strip painted, simulating the seat belt. But then a couple of questions. One is if this whole discussion shouldn't be framed within the context of practical ethics that was suggested by a former director of the Safra Center, in which things are not always in one way, but things are and decisions are made with a diagnostic approach. I mean, is when is the interest of the individual and when is the interest of the statistical life. And then the second question is regarding the Chilean miners. This has been mentioned during this session several times. And I wonder if that is not a case of moral ambiguity from their side. Because recently, the Minister of Communication of Chile and who is currently the Minister of Public Infrastructure gave a talk at the forum at the Kennedy School. And he, of course, shows a lot of pictures, a lot of photo opportunity there, but he did not mention in any part of his presentation the help that they got from abroad in financially, technical, and in human resources. And also with nothing mentioned about if this event resulted in any improvement in the quality of life of the Chilean miner that is dismal, and also in the working condition of the Chilean miner that is also dismal. So in my opinion, it is a clear example of moral ambiguity and I wonder if the panel will help me in the consideration of these two issues. Thank you.
That's, I think, an open question to anyone who wants to take a stab at it.
Well, I'm always willing to take a stab. Sometimes I miss. Did it improve the quality of life? Well, one might say what would have improved the quality of life of the miners would have been to take safety measures that would reduce the risk of this sort of thing happening in the future, assuming that these miners go back to work. I have no idea whether that happened, but that would be one way to improve the quality of life. Another way might be you might think it's not the question is, where does the budget come from for this very expensive rescue operation? Well, if it comes from other things that affect the quality of life of these miners, then again, it looks like not only will it not improve the quality of the life of the miners, all things considered, it'll make it worse because, again, the opportunity costs of spending this much on the rescue efforts. Now, it may be that what would in fact have happened, again, I have no idea whether this is true, is that this would bring attention to the Chilean public of the risks that the miners are facing and could force greater safety measures. Sometimes that's what has happened from environmental accidents or workplace accidents in this country, that it in fact does make the life better. But that's varies from case to case and depends on a whole host of circumstances. I don't know whether it in fact did there. I'd be a little skeptical.
Anyone else? Okay, thank you.
Negative, right? Okay. I'd just like to ask the panel, how would this impact our discourse this morning if I pose this to you? The old Jack Benny joke where he's approached by a robber,
Yes.
and the robber asks him, your money or your life, and he pauses. Could this shed any additional light to our conversation this morning?
Certainly is a good joke.
You didn't finish the joke. You hear Jack Benny walking down the sidewalk, and then a voice says, your money or your life. Silence. I said your money or your life. I'm thinking.
So have you thought of an answer?
It depends if it's Jack Benny's life or someone else's.
Could I make a remark about it? We talked about identified lives, and it occurs to me that the two ways that a life can be identified. One is the identity of the individual is made known by name, by photo, by social security number. The other is that it's an identified life because I can identify with it. When I talked about this 6-year-old girl with brown hair, I think the reason I could identify was I never had any daughters, but when this happened, I had 4 small children, and I couldn't help thinking, she deserves better than her grandfather in terms of saving her life, because I can identify somehow with her parents more than with her grandfather. And I think every now and then I'm asked, since I am not a believer in God, I'm asked how I can have any moral sense if it doesn't come from some kind of religion that can give it to me. And when I think about it, I believe that my moral sensitivity began when I was in the 2nd grade of school, and I got a book for Christmas. The title of the book was Smokey, a Cow Horse. And before I finished the book, I was crying. And I think there are lots of people who can so identify with a dying child in a movie that they will cry right there in the movie. Whether they identify as if it's my dying or my little sister's dying or my child dying, nevertheless, there's a sense of identification that's sort of inescapable. And I think probably we're all better off because people have those feelings, even if it does make them occasionally somewhat distort what you might call a rescue program in order to give them satisfaction.
Could I just underline one thing that Tom said in the course of that remark, which I'm sympathetic with, which is that the degree to which a life is identified varies substantially. You know, when we think of the girl in the well, and there were all sorts of pictures of her and her family's talking about her, or we think of the mine collapse, the families are at the entrance to the mine, and they're showing pictures of the people down in the mine and so forth. Whereas knowing the social security number of the person down in the mine, well, that makes it identified as well, but to a way which isn't likely to evoke the kinds of responses. You're not likely to cry when you learn the social security number of the person.
I just wanted to pose a question which follows on Tom's remarks, but it's partly addresses this issue. So suppose that, and Tom in effect was saying he was very thankful that we are responsive to this sort of identification and connection with people at risk. And one possible scenario is that if we didn't pay attention to that in our policy decisions, over time we would create conditions in which people would respond less and less to that, because people might be shaped in part by the institutions they're in. And they might over time then be less willing to contribute resources to rescuing people, even though they might adhere to some view about the equal value of identified and statistical lives. So one of the hypotheses is that this is not simply a warm afterglow, but it's connected to strategic reasons for thinking that as a society or as groups of individuals, if we don't follow policies that rescue identified people, even when it's perhaps more costly to do so than we might imagine, we would want to embrace as a policy, we're going to end up rescuing fewer people in the long run. So this is a kind of consequentialist argument that would say we're calculating the lives saved in the wrong way, or we're not considering all the practical components of that. And I wonder if that has any...
I think that's just like the treatment prevention argument in the case of HIV, which is that we can't raise the same resources for preventive efforts because people don't identify, and so we give greater weight to the rescue efforts, in this case, the treatment, and that's compatible with equal value to all lives, but we need to pay attention. Essentially, the argument goes, I think it's essentially what you're saying, we need to pay attention to the fact that when we focus on treatment, in fact, there's this important additional outcome, namely we have more resources and can save more lives. The other thing I would say is that just like we don't want to have a policy which tells us, well, we've decided not to save these guys who don't wear helmets, and so we just leave them bleeding on the street. We don't want to live in a society that does that. We don't want that to be expected of us. We don't want that to be expected of others. And so we need to pay attention to what the implications are of saying we just have to be rational about this and save the most lives possible. And if that means walking away from the identified persons at risk, we have to think about the effects on us, not just the effects on the person who isn't treated.
Anyone else want to comment on that? Okay, Steve?
This last exchange brings to mind something that has been discussed recently and is the subject of a book I'm going to cite in a minute, especially Tom's reference to the book that inspired you so much as a child to cry in the films. I haven't heard much mention here yet of the neuroscience behind altruism and the parts of the brain that are triggered by these types of emotions that are the result, obviously, of evolutionary biology. So in our species, there is certainly reactions in the brain of this type of emotion that causes us to have certain types of reactions. I presume, and I would defer to the experts in the room who know much more about it than I do, but it's another part of the brain that is seeking to apply statistical methods to making policy decisions. So that we have, in fact, two different domains in the brain that are stimulated by the type of situation in which you're counting statistical lives and the type of situation in which you are feeling empathy. In a fascinating article in the New Yorker, which I'm sure many of you have read, Kin and Kind, I think is the title of it, the discussion of the history of the formula that was developed by Hamilton to an economic formula to define altruism was challenged, and now E.O. Wilson has published his book, The Social Conquest of Earth, in which he discusses in greater depth these evolutionary biological dimensions of the difference between how we reason about statistics that can be involved in certain type of decision making, and how we reason in response to the neural reactions that are highly emotional and that stimulate us to feel this type of altruism. Do these reflections stimulate any thoughts of the panelists?
We don't have to go that far.
Yes, what part of the brain? Exactly.
Just, I was I didn't know if I should go there this morning, and so I didn't because it's not my particular area, but there's a wonderful book that Danny Kahneman just published on thinking fast and slow, which is basically about the idea that different parts of your brain are dealing with different kinds of circumstances, and it's sort of the difference between 5 minutes and 5 hours of sustained thought on something. So that may be a part of it. I don't think that's the only thing going on, but I think part of it is sort of, what can I do right away because I'm going to feel horrible, because, there's a part of me that wants to act right away, and then what do I think when I've got a more measured response to it.
Tom, did you want to say something? Tom?
No, I think, I'm glad the point was raised, but I don't really have anything to contribute.
Gentleman in the back.
I'll say the same as Tom said.
Hi, I guess I have a question about the way we are sort of structuring some of the discussion today, and that we seem to be making a comparison between devoting resources to saving statistical lives or devoting resources to saving identified lives. And I wonder whether the decision context is really sort of spending on either of those two things, or devoting resources to consumption, or devoting resources to something else. And given that I think we agree that consumption is reasonable, like it's reasonable to spend money on a nicer bottle of wine, on a new pair of shoes we might not need, isn't saving sort of, I guess, these warm glows we're talking about, aren't they another form of consumption? And therefore, saving those Chilean miners' lives, isn't that just a efficient sort of joint production, in that we're getting something which has intrinsic value, the lives saved, but we're also getting a lot of that warm glow, and we might otherwise devote resources to getting that warm glow from, again, this nicer bottle of wine. And so it seems we have to set up rules how to sort of separate these things, and how do we develop those rules? Thanks.
Anybody want to talk about wine?
It sounds like David should respond to this. I think you probably have at least some training as an economist at some point. And yes, one can say that, so yes, we could say the warm glow is just another piece of consumption that one gets in here. But one could also then say, well, wait a minute, because if over time we don't have that warm glow anymore, we keep calling it that, but I think it means also if we don't have certain motivations which produce that warm glow, then that may have changed us in important ways that we need to think about whether we want to be changed in those ways. So it is another kind of consumption, but it's also something else which can structure what we're like as human beings.
Just on that latter point, the welfare evaluation of how you think about a person who may have one utility function one day and another utility function another day, even if all you're doing it from is the individual's perspective, is an extremely hard problem. And you sort of have to decide which individual you're thinking about and how would the person have sort of thought about them and stuff. So it's actually, it gets into a very, very complicated realm of economics.
And it complicates things.
Take the last question.
And it complicates things for any consequentialist moral theorist.
I think it's absolutely critical that we retain our humanity. On the other hand, one part of our humanity is our rationality. And part of that rationality looks at the statistical individual and looks at the numerology associated with the statistical individual and screams for it to be addressed. I think that because of the way we're constituted as human beings, there's always going to be a tendency for us to go in the direction of the individual. I think what I found disturbing about the discussion today, and I use the word disturbing, is that it appears as if we are willing to capitulate the statistical side, the rational side of ourselves as human beings. And I think we can address that rational side without giving up our fundamental moral character as human beings. And so I'm not happy with what I've heard today because I think that we're we're in essence allowing the drift of society, which already is devaluing the statistical component. It seems as if we're capitulating our mission to address that side of our humanity also.
Most of the argument I've made, I would understand as supporting the statistical side. That is saying that a variety of arguments that have been, that I could think of and that are in the literature, so, to support why we should give more weight to the identified lives as opposed to the statistical lives are bad arguments, or they don't succeed in what they're trying to do. So I took the way I ended up leaning as more in the statistical side than the identified side.
Tom?
I think there's a very strong argument for saying that these emotional responses shouldn't govern legislative or executive activity. The idea that the U.S. government, depending on which department or which bureau of a department you listen to, may value any human life at large, any American life, presumably, only American lives, anywhere from $500,000 to $150 million, and that's sort of ridiculous. And I think there's also a lot of misunderstanding about when you ask, what is the worth of human life? You have to ask worth to whom? To whom? Because if you're going to mandate that every house has to have an expensive lightning rod that people might not buy because their life isn't worth the estimated value that they save by putting up $150 lightning rod on top of their TV antenna, that should be their business. Now, I think the motorcycle helmet is a different issue because clearly you're going to send an ambulance and spend a lot of money trying to save the guy, and we don't want to be a society in which we let somebody bleed to death on the sidewalk. So I think that it's very important that people who try to determine, let us say, with respect to mandatory safety equipment, how we should value the lives that may be saved, they shouldn't have in front of them photographs of dying children and things of that sort. They should be obliged to cultivate that part of their brain that can think about this in an executive fashion. So that, but then if the question is, should we allow that lady in the Salvation Army uniform to ring a little bell over a red money bucket because it makes people feel good to come out of the store and drop a $5 bill and be rewarded by a smile and a thank you? It seems to me that we want to encourage people to be generous, to be empathetic, and all of that. And I don't think there needs to be that conflict. The conflict exists, I think, but that's mainly a result of maybe too much inhibition even within the U.S. government in thinking about the issue of how we should value lives. And I think that's a deficiency on the part of our government, not on the part of the populace.
Well, thank you all for helping us to frame this problem, which we will continue to address after lunch. I'm hoping you don't have too much conflict finding food, which is really out in the food court, and you have a range of choices to make there. So we will welcome everybody back at 1 o'clock, and you have a while to get some lunch and maybe grab a few minutes of fresh air outside. So thank you all, and I would like all of us to thank the panel for